getting out of the inpatient world, it was night and day different. And I
Yeah.
don't know if I was as fully prepared for some of that mentally as where I am now. Working at the bedside, people kind of anticipate to be there to support you. My
Mhm.
husband would always, if I called and said, "Hey, I've coded someone 14 times a day, like I feel terrible," there would be a meal on the table, there would be support. It's really hard to call someone and say, "Hey, I've done 4 prostate exams today," and
Yeah.
like feel the same amount of compassion for you.
Yeah. We have such a fire interview for you. I cannot wait for you guys to watch it. This is my friend Audra, who's joining us via Zoom. She is a family nurse practitioner specializing in primary care with a couple of different little subspecializations throughout the entirety of her career. She's a bedside nurse, and she's one of the few, if only, bedside nurses that I've ever worked with personally who knew from the beginning that, yes, I want to leave the hospital. Yes, I want to do primary care. I'm going to take an FNP track and I'm going to be just fine. I haven't met many people like this because typically people who work in hospital, they like the shift work, they like the buzz, and segueing to working in a clinic with primary care is a very, very different vibe with a whole different set of challenges that not a lot of people anticipate well enough to continue that feeling of reward. And Audra is one of those people who knew what she wanted. She's gotten so much reward from it. She's seen the challenges that come with it and kind of pivoted her way through it to make such a beautiful career. Some of the highlights that she's going to talk to you guys about today are how to choose your specialty, how to know that this is what you want to do, and what is involved with the pros and cons that may come from a field in this. Some of the workplace woes that you experience in clinic settings, particularly primary care, and some amazing, amazing tips about how to acquire your first job, particularly if you have no experience. So I hope that you guys enjoy this interview and this time with Audra. If we haven't met before, my name is Bree. I'm an RNNP mentor, interview strategist, and content creator. Thanks for joining. Okay, so Audra, if you wouldn't mind just telling folks a little bit about your background in nursing and kind of how you segued into wanting to become a nurse practitioner.
Absolutely. So I started as a pre-law student at the University of North Georgia, which was crazy, I know. But so then I very quickly felt a calling to go towards nursing. I started working night shift. I worked in the ICU unit there. I did an externship while I was in my ASN program, precepted with some phenomenal nurses in the ICU. So that was a great transition to get to be on staff there. A lot of consistency with ICU and then big change into like family practice outpatient kind of world. But a lot of my educational background, all my educational background actually is from one university, which I feel like has some pros and cons along my journey. But I've got to be able to stay in the community I grew up in. I've got to work in the community I grew up in for the majority of that. So again, pros and cons with all of that. But so
Right.
that's how I've got to where I am right now. Graduated in 18 with my
Okay.
MS, and they actually just had an MS, not an MSN program, but so I have MS with a specialty or focus with the family nurse practitioner certificate, and went from there.
Okay. So you were a bedside nurse for how many years before you went back to school?
So I started in 14, and I actually, which this will be part of my story in a minute too, but I didn't leave when I got my master's. I actually stayed for another year. So I was there for 6.5 years total. And so then I was there for 3 years before like I
Okay.
really kind of transitioned to a master's program.
Yeah. And what kind of led you to the point at which you're like, okay, I'm working in ICU. I love this too. Maybe I want to do something different and I want to consider going back to school.
Honestly, I felt like it was because as much as an intervention as you can serve to be a nurse at the ICU level, you're missing 80 to 90% of a patient's life. And if patients can have an advocate for them, or they can have someone present something differently and empower them so that they don't come in with DKA and they don't come in with pneumonia, then that was where my heart really gravitated towards. I have always loved mission work. I went on several medical missions when I was in school. And so I just knew in my heart this prevention, like this umbrella term of prevention, was something that I craved that you can't do at the bedside. I mean, you can love on people and you can help them get well, but you really can't, once they leave your doors, you're left. And so that's kind of what pushed me. There were some other things as well. I think the climate's changing as far
Mhm.
as longevity for nurses at the bedside,
Sure,
mentally, physically, emotionally. So I think there were some components of that as well. I was
sure.
young, I was looking at getting married and starting a family. What what is sustainable long term? And I also was kind of selfish. I kind of wanted to go ahead and get a degree, regardless of how I started using it, before I really started my family and got into that
Mhm.
process, because I, as a student, I had to study a lot. Like that was school was not easy and simple for me. So I knew I had this passion. I knew I had the desire to change. I knew I didn't really want to wait forever. And so I just kind of had a good golden open door. And that's kind
Yeah,
of how I started getting in through that and
yeah.
realized I wanted to change. So
What I find personally in my little world is that a lot of people who are used to working shift work in the hospital, acute care kind of stuff, when they go to working in particularly preventive medicine, which is a very all-encompassing and can be kind of draining in some respects way if you don't have that strong passion for it. And so a lot of people end up going back for their post-cert. And you're one of the few people I've met who did not. You knew exactly what you wanted to do from the get-go. You did it and you're still doing it all these years later and loving it. And so I think that is very, very special. And so part of what I want to tease out from you is how did you like did you inherently knew I want to practice with preventive medicine? There was no real like I'm just doing this because I need to at this point.
no, well, so in transparency, to be honest, I don't feel like I know that I know that I know all the time. I like when you hit the nail on the head of people get in this field and schedules are tough and the patient load is tough. I think you can walk into it with a large passion, and I think your path can be modified. And so
Mhm.
I don't think by any means, starting with an FNP certification is that I'm starting with a broad scope and I can narrow in.
Mhm.
I've changed like groups of people that I've worked with, because I started out in indigent care. I worked with Good News at Noon in Gainesville. Shout out to them. They are a phenomenal organization.
Yes, they are. Yes, they are.
And if I were not young, broken, in love, I would have stayed there
Yeah.
for because they are an amazing facility to work through.
Love it.
But so that also, I made a career change knowing that I had never, they don't do billing and coding and things like that to that extent. And I wanted to learn and grow and keep pushing through in that practice specifically. But um, it's hard. Family
Yeah.
practice is so challenging, and not in the sense of that you watch people die every day, but the paperwork and the hours and the administration time, it's all it can get heavy.
Yeah, I can.
You have to be able to sit down and see a patient's face in your day and know that you're the bridge that like made a difference there.
Yeah.
And there's times, I mean, I'm even still there will probably potentially still be further career changes for me in just the environment I work in. But
Mhm.
I think that's what brings it back to why I've always known is that is at my core what where I feel like I fit in healthcare is I
Mhm.
want to be that bridge.
Yeah.
And I feel like with my certification as an FNP, that is really my bread and butter of what I do every day, you
Yeah.
know.
Yeah.
I think that's kind of what kept me on that path specifically.
I know a big challenge for a lot of folks who are doing their FNP, particularly even ones that are in very, very well-known schools. Very few of them guarantee clinical placement for you. And clinical placement can be a challenge in a family program in particular because you have two very difficult rotations, your OB and your peds. It's sometimes
Mhm.
hard to get in and find preceptors for that. Did you find challenges with that? How did the school help you?
Oh, 100% no. Great school, great instruction, no follow through with clinical placement. Like it was down to the wire for me on my pediatric placement specifically. And it was just you have to find something.
Mhm.
And so eventually there were some kind instructors in the program that gave me like colleagues' names or informations, because basically where I ended up was a family practice in Blue Ridge, Blairsville, that
Mhm.
seemed basically birth to death, because obviously the further north you get, the less you have as far as like specialty offices there.
Right.
And so they had providers that would even like go help deliver babies or see the babies in the clinic or in the hospital. And then they would come have their like first day old, 2 day old, 3 day old
Mhm.
appointments there. And so that was because of a friend of a friend of a friend helped me get that. And so if you are ever fortunate enough to find a program that pays preceptors or has a like a list ready for you, raise your hands and say hallelujah, because
Yeah.
that was one of the most challenging. And I actually right now I'm precepting a family nurse practitioner student for women's health, but we're a student health center. So
Mhm.
people kind of scratch their head at that, but we offer the women's wellness, the birth controls, like STI type illness
Mhm.
exams and things like that. And so she's getting a lot of her GYN, which I'm actually finding that FNP programs are steering away from more of the OB side of it and just steering towards the GYN portion. So they're doing like classroom based instruction just on the OB type part. And then, so that's how she was
I
able to
see.
fill her hours with me, is because
Yeah.
they were more focused and expecting on that GYN side as a
Mhm.
family provider. Because while we can have care and work with OB, typically it's rare that you'll see just an FNP in women's health unless they've had some background with NICU or labor and delivery. It's typically a women's health nurse practitioner
Yeah.
that we're seeing in this market that are with GYN type practices and things like that. It's probably the hardest part of school for me, was finding a good preceptor for those
Yeah,
rotations.
that is a universal
Hard.
problem that I've
Yeah.
heard so many
Yeah.
horror stories about.
Yeah.
And I think if you're male, it even
Mm.
double and triple makes that more difficult.
Oh, 100%. Yeah.
But a lot of people I've spoken with have told me the exact same thing, that they utilized a practice that maybe tended to see 20% peds, and they would focus on that population during that rotation. And
Yeah.
they would luckily have preceptors like you who would prefer, if we have a panel of 10 patients today and 2 of them are under the age of 18, these are your people,
Yeah.
and we talk through those kind of things. So you can get it in that way, which is something I would have never thought of. So I think that that's a great concept to put in people's mind, is it doesn't necessarily have to say pediatrics on the sign outside the door. You could still
Right.
get in certain practices. So I think that's a really good tip for people who are struggling to find something.
And I know it's harder to want to travel or to drive, but don't be afraid of going to some of those more rural areas, because they are a wealth of knowledge. You'll find
Yeah.
providers there with that are managing things that you would see six
Mhm.
specialists manage. So especially from a family prevention perspective, like don't be afraid of utilizing those more rural and like remote areas to go to, and just
Mhm.
try to find, find a little Airbnb or find something that works
Yeah.
for you that you can
Just
do with
knock it
that.
out.
Yeah, because
I
it's
would think another benefit to that is that they probably don't have a lot of students approaching them versus
typically,
the
yeah.
the places that were within a vicinity of your school are going to have a
Yeah.
lot more of
Oh,
them.
for sure.
So yeah. Okay, that's a great tip. Was it challenging trying to find a job?
It was
Yeah.
so challenging.
Yeah.
So I say this truly and genuinely lightly, but I was naive when I walked out of school that there would be a job, and that would be, ready and they'd hire me, because the facility I was working for paid for a majority of my school through scholarship. So I thought logically, well, they're going to roll me into a role that
Yeah, they're gonna it's a
they've
pipeline, they're gonna wanna
invested in.
keep me, yeah.
But then they would come back and say, well, you need 3 years experience. Every position I applied for, 2, 3 years experience. Um,
Mm,
and so I cried, I prayed, I talked to other colleagues, and started as a part time provider with the Good News Clinic in Gainesville, and loved that, but still worked. So I was still part time at the bedside because they only needed me a couple days a week. And thankfully, that rolled into a full time position. And then meeting people in that practice kind of helped expanding where I was going with that. But it was a huge struggle. And
yeah,
that's the thing that I want to tell people to not get disappointed on, that everybody goes through it. If somebody comes straight out of school with a job, the stars were aligned and something worked in their world. But a majority of those people will be individuals that really made connections in their clinical rotations
mhm,
and found an opening at a clinical site.
yep,
And so if you can also keep an open mind and not, say, for instance, work at offices that are affiliated with the health center that you're working for, or where you're, again,
mhm,
living. Like if you open a door and go somewhere that you're uncomfortable just in meeting new people,
yep,
then I have seen a majority of that turn into wonderful job offers. Basically, everybody that I was in school with that went to a clinical rotation that they kind of were uncomfortable or on the fence with to get started just because they didn't know anybody there, that was always A, the most beneficial, and B, typically turned out to be a job offer at the end of that, because you have to keep an open mind with locations and clinics that are looking to hire new providers. So don't get discouraged if someone says out of the gate 3-5 years experience and they want that, and you say, how in the world am I ever going to find that? Try to look for clinical sites and keep in mind places that potentially could be hiring or an open door, even if you're kind of anxious about how that's going to turn out. So
Yeah.
don't turn that away.
Yeah, I tell people that all the time. I'm sure everybody watching this is sick and tired of me saying, I think I say it on every single video, but clinicals are your number one source of job acquisition. Show
Well,
up like the working interview that it is, because even if they say they have a spot and they need 3 to 5 years, they see you in action. You're a hard
yeah,
worker, you're a quick learner, you're easy to work
awesome.
with. They are
Yes.
going to be willing to forego that 3 to 5 years to train you because you'd be such a good workmate.
Well, and so here's the other thing I'll say. So the role that I came to next, that was my first full time, that I would say is my big girl nurse practitioner job, privately. I think that's why she had so much faith in me, is because I was someone that she could help teach and encourage and kind of model.
Mhm.
She, as my business owner and supervising physician, she functioned and did more functional holistic medicine, which is something you don't learn in school. And so
Yeah.
she wanted me to be a fresh mind. She did not want me to have practiced for, 6 years in a
Mm,
traditional industry
sure.
and like thinking only of antibiotics for this and this and this. She
Yeah.
wanted me to be able to think, well, what's a supplemental way
Mhm.
that we can approach this problem, or what's a lifestyle change that we can approach this problem with, which is not at all how you're trained in school.
Yep.
You could see it as a benefit. And that is also something that people forget to market, is while I don't have experience, I have a fresh and open mind,
No, you
willing to
do.
learn and work. Like, word that in your interview, word that in your expressions, like be very open-minded to what you're learning in the instruction they're giving you at the clinical sites, because I mean that could be your benefit right there. And
All
I
right, so you started at the Good News Clinic, which is an underserved population in our community. They do such great work there. And then you segued into working for the university. And is that your full-time job now? That's what you do?
currently,
Okay.
a funny story, I'm about to transition into teaching, so it's about to
Oh,
be
yay.
a more PRN part-time gig here, but I'm going to start teaching with nursing because, again, so open doors, God changes that path. But yeah, so I'm full-time
Absolutely.
currently here,
Mhm.
full-time at the Student Health Center.
And how are you liking that?
So it is so different, in that there are pros and cons. So traditionally, student health centers, especially here at the University of North Georgia, we've been able to offer like an in-house pharmacy, so patients could get their prescriptions here. So we would see them, we would do testing. So we could do UAs, hemoglobins, all of your COVID respiratory type illness testing. We do have labs, so we could do like CBC, CMPs. Again, that's
Mhm.
kind of out of pocket for patients because we don't bill insurance. But so it would be a student that basically had some reduced income, or didn't have a car, and they could come here and get basically everything. So that's changed a little bit financially with our budget. We are not able to offer as much, but all of that rambling to say, it's full practice. You get to really like put on a different hat of, I never dispensed medication before.
Mm.
And so to be able to do that under our protocols and guidelines through supervising physicians and how they have that set up here was unique for me. It made me focus and learn more a little on my
Mhm.
pharmacology per se. It wasn't just an easy
Yeah.
click in a computer system. In a traditional office, you get backed up, two, three
Yeah.
patients at a time. Here, we all just kind of flow together and we don't have a specific set of patients that we see.
I
So if
see.
someone gets caught in an emergency or a situation of need, we just adapt and like keep moving through that. The thing that I think I've struggled with the most in this position is because we don't order diagnostics as much. It typically works out that everything gets taken care of. You're just not the
Mhm.
person ordering that. So,
Right, right.
but that's
Working
unique.
within the limitations of what you can and can't
Correct. Yeah.
do and trying to
Yeah.
help them the
Yeah.
most.
So there,
So you did talk on, and I would like to expand a little bit on some of the challenges, I think, going from working like shift work, particularly in ICU. You have your two set patients, your tasks due during the day, you do them all day long. Your shift is done, you clock out and you're done. You pass it on to
yes.
someone else. Some of the challenges that I hear from folks who go from that type of setting to outpatient is not only the workflow, which you touched on a little bit. You've had some different kind of experiences, but many people, when they first go into a broad overview home for patients in primary care or urgent care, find themselves very overwhelmed with the pace at which they have to pick up and suddenly see 5 patients an hour. And how do
Mhm,
I finish this in an 8 hour day? And does my 8 hour day not segue into 12 hours? How do
mhm.
I finish my charting? Do I have administrative time? So some of that like workflow struggles that you did
Mhm.
not have to experience when you were working bedside. How did you experience any of that? And how did you navigate through it?
Oh, 100%. So your communication with patients can make or break your day. And I start with saying that because if your office schedules 20 people a day, they're
Mm,
going to schedule 20 people a day, regardless if you enjoy talking to them about their beach vacation or
that's
not.
right. Right.
And so, or if you choose to take a conversation with a vendor or a rep that comes into your office, or if you choose to try to sit down and do labs in the middle of your set schedule of patients, the way that you prioritize your time management and communicate, I feel like those are tied together really will make or break.
Yeah.
There is no amount of clinical exposure that until you're the person responsible for all of that can really make you understand. I think, and there's a lot of preceptors that can enlighten you on how heavy the load is going to be. But I did not do a good job of that at first. And I'm extremely transparent to say that I was there way too long in the evenings doing lab reviews and things of that nature. But again, because my passion was sitting down and talking to people. So I knew my trade off was at the end of the day, I spent 45 minutes reviewing labs and answering emails that I didn't get to do during my day. So you have to, give yourself grace your first, I would say, 2 to 5 years of learning this. And B, you have to constantly be adapting. What worked for you last month, last year may not work for you in your admin time
Sure.
now. And the a thing I can advocate for is I don't think that we as new novice nurse practitioners, when we're getting hired into roles, feel like we can advocate and negotiate for admin time to be built in. But if
Mhm.
you can find a business owner, an office manager, whomever's making that decision for you, that's willing to give you a set hour at the end of the day or a half day in the middle of the week that you can just do some time, that will save your career. Because
Yeah.
if not, it will get heavy and you'll
Yeah.
start beating yourself up. But you always have to be able to give yourself that grace and say, okay, I did not do a good job of going home on time this week. What am I going to do next week? How am I going to chart while I'm in the patient's room? How am I going to prep my charts the night before? How am I going to utilize my electronic medical record and like optimize how I'm getting things into the chart? How am I going to further rely on my office staff to take care of tasks? How am I
Mhm.
going to delegate?
Yeah, agreed, agreed. I always tell people who are that I'm helping with contract negotiation, like, you might not consider asking for more money, just ask for time instead,
Yeah.
because time is money ultimately.
Scribes are something that
Mhm.
several of my other colleagues that I've seen in other industries will utilize, and they don't always go for that. But like as an example you were giving, instead of more money, well, how do I just see more patients efficiently? So if you don't want to give me more money, but is there a way that you could like swing
Mhm.
an MA that covers half my afternoon that scribes for me? Or like, how does
Yeah.
that function? So that's just another idea to think about as you're going into practice.
In regards to orientation time frame, like, did you get a week where you followed someone around hand tied to them, or was it a ramp up process, or how did that work?
So I have had probably three unique experiences in that. So when I started with Good News, I don't remember exactly how long day wise, but I did follow a nurse practitioner colleague. So I was not with a physician, but I followed her, and it was more about how to use their charting system,
Mhm.
kept supplies for procedures, things like that. But it was shorter. It
Mhm.
was, I would say, a couple weeks, if that.
Yeah.
Like it was a lot of just like go with the flow. But they also, it kind of felt like a walking orientation, in that if I was having a rough day of not figuring out where things were, how they did something, you stop, you ask a question, there everybody's there to help you. So that was totally appropriate. At my second job, which I spent the most time at, I followed the business owner, who
Mhm.
is the doctor basically that traveled to all of the different locations. I followed her specifically for a few weeks' time. And then
Mhm.
I followed one of her mid level providers. And then they would slowly give me like 2 patients a day or 3 patients a day that are theirs that they would normally see. It would be like an easy wellness check or
Yeah.
a weight loss evaluation or something that they knew I'd have questions on how to chart. But again, not pack my day. And so I did that for several weeks at a time at that facility. But then I bumped and moved and went to a newly opened facility in my community, and I was the only provider there. So I had a front desk staff and a medical assistant and me. And so lots and lots of cell phone conversations
Yeah.
and information there. Um, and so that was a lot of challenging because it wasn't so much at that point clinical skill of like application, but then it was just not knowing the office management side of things and not knowing how things were flowing. That
Mm.
was more challenging because it was things that I didn't feel like I'd had exposure to.
Right.
And then coming here to the college, I shadowed for a couple weeks time. So that was an easier jump.
Oh, yeah,
But
for sure.
so then it was just learning again supplies and what we can facilitate here and what we can't and how we work
Mhm.
through that. And then it's a whole nother side of higher ed, like learning to
Mhm.
report things to and learning how to ask the right questions on how this applies to someone who's living on campus versus who doesn't. So
Mhm.
each career that I've had or each job that I've had, different time frames and like drastically different oddities that go
Yeah.
with. You wouldn't need to know where someone resides necessarily at my middle job, but at my first job that would be important. And good news, like, are they homeless? Do they have shelter? So it's just funny at what the little elements are that come together. But just be prepared coming out of school that what is promised as orientation may not come to fruition, especially if
Sure.
you start blowing someone out of the water. If you showed them that you got it sooner, then they're going to let you have it sooner.
Yeah.
And that is not always to your benefit. So I'm
Mm.
not saying to not be a good performer in your orientation, but I'm saying advocate for yourself as well to say, I'm not really ready for that next step. Please let me have a couple
Yeah.
more with a provider. Please let me have a little more direction here, because just when you feel like you're confident, eh, think about the anticipation you're about to get a full day of patients. Like,
Mhm.
especially if it's a very busy primary care office, they're going to be ready for you to take on a full load. So utilize and optimize all of the time they will give you.
So I do want to talk just briefly a little bit about some of the less healthy workplaces that can be out there in clinics. I feel like as mid-levels, APPs, if you will, we are always going to be in a position where we're kind of in between. And there are a lot of unhealthy work environments for us, whether no matter what specialty you're in. But
Mhm.
I find from the clients that I meet that I see a lot more of it in the outpatient world than I do inpatient. And
100%.
so when I'm counseling people or we're talking about like job interviews, people are always kind of thinking through like red flags, like, is this a practice that's going to support me, particularly from our new grads? When you've had a little bit of experience, whether it's a good experience or bad, when you kind of know what you're looking for in your next job, but when you're brand new, the whole transition from nursing to now being a provider is you don't know what you don't know.
Mhm.
And it can be a little bit nerve wracking when you're in an interview with someone and you're like, I don't get a good vibe here. I'm not, but then teasing out whether or not it's truly going to be unhealthy or not can be challenging.
Yeah.
So, are there any tips that you could offer, or things that you've seen either in interviews or in looking through other job sites that would raise concerns for you, as this might be, I might be overworked, this might be a physician or director who's not going to be supportive or orient me properly, anything like that?
If it's somewhere that you have been in the community, for instance, home, and you know that they've had 4 new doctors in that office in the last year, that's probably a red flag off.
Yeah.
Like, that's a super simple. And I mean that. And also, if you walk into an interview and they say, yeah, our last 2 nurse practitioners just haven't worked out for us well,
Yeah.
if they're very intentional to put the verbiage on that those individuals weren't great fits and that their lifestyle really didn't accommodate for their clinic, that's a flag. That's a big
Hmm.
flag. I also find that if you walk into an interview and they say, um, how many patients do you anticipate to see? How many patients do you want to see? We see 25 to 30 patients a day. And like, if that's the first round of questioning that they get out of the gate, is not, where do you see yourself going in 5 years? What do you feel like you could bring that's an attribute to the clinic? If they're not really looking for you to self-identify the strength that you have to bring to them, if they're very focused on turnover and production and
Hmm.
numbers, and if they start quoting things like RVUs and telling you bonuses, then those are red flags to me, because an office that truly wants to invest in you and watch you grow is going to give you the time and grace. I would like to hone in on if they are easy to throw other people under the bus. So, for instance, if they say, well, just be careful if those MAs, those MAs, like, and that's even as a finish up. So, you've had a great interview, you're shaking hands, you're thinking, this is going to be my dream job. And on the way out, they're like, oh, just don't walk by that nurse's station because, so and so's in a bad mood today. Like, if someone says that to you on the way out of your interview, you should be like, oh, I really need to pray over this, because there's a difference in being able to be a light and tolerate someone and having someone that's your MA that literally can make or break your function and your practice. So if they are giving out vibes of other people's fault and other people's expectations and stay away from this, then there's some subtlety in which people will include that in your interview. Just listen to that, because one of my favorite quotes is, once someone shows you who they are, listen to them. So if they are so focused on showing you those negatives in a way of, oh, just ignore that, then it's an issue and it can be a problem for you. So think through that. Also, I went for an interview one time, and I went for an office manager, and she continually answered the phone. Now, the first time it was fine. The second time was fine. The 10th time, you're not a priority. There's something else going on. They're not feeding into you. So if they can't polish it up for a 30-minute to an hour interview, then you need to realize you're constantly not going to be their priority. Whatever else is going on is that priority. So just, again, let them show you who they are. If you're getting bad vibes immediately upon getting into an interview, it's a bad vibe. So trust your gut. Don't be so blinded by wanting to get employment somewhere and wanting to get started as a provider that you set yourself up for a terrible first job or for failure in a way. You are an investment to them. You are an investment. No matter if you work for them for a minute or 2 minutes, they are putting time, they are putting money, they are putting energy, they are trusting patients with you, they are trusting a reputation with you. So if you don't have a group of people around you that treat you like you are their investment and that they are going to cherish that, you wouldn't buy a new pair of shoes and then run them through a mud puddle. So like, if they are not treating you like the investment, not saying you be bougie and diva on somebody, but they need to treat you like the investment that you are to their company or their industry. So, somebody answering the phone that many times, they're not investing in you. They're not even trying to figure out who you are. They're just trying to figure out if you check their boxes so that you can make them money. And long term, that's going to be detrimental to them.
What I think a lot of people falsely assume when they go back to nurse practitioner schools that I'm going to make more money than I am at the bedside. And particularly these are post-COVID nurses who are used to big money, which you are not likely to make as an NP. How do you think through like your return on investment? Okay, here I am working at the bedside making pretty good money. I'm going to have to spend this much on school, and how much can I anticipate making, particularly if I'm going into something like primary care, which is notorious for not being as higher paying for NPs. Was that something that you were just willing to accept because the trade-off was beneficial to you, or have you noticed a change in your pay?
So I never really let pay make the decision for me to go back to school. So yes, when I came out of school, I was willing to take whatever. I wanted to get started. I wanted to find a good place to get a good, strong foundation of just clinical practice and learning how to work with others and learning a new role, because again, you're not a nurse anymore. You're elevated in that stature. You have to anticipate that you're going to make probably about 75 to 50% of what you were at the bedside, especially if you're looking in a primary care setting. The COVID nurse differential pay, I can't speak to. So that was back when I came out. I was looking at making about 50 to 75% of what I was. Again, there's payoffs. So you have to look at time as money. And especially if you're going to be a working parent or have another passion that you want to travel or things like that, you have to look into, I'm getting extra time off, I'm having a more consistent schedule, I'm XYZ, so that equals what I'm lacking in pay. But don't get so focused on pay in a primary care world that you find yourself trying to stress over bonuses and RVUs as well, because then that's another world that they'll suck you into in primary care. The more you see, the faster you see them, the more you bill. Preventative medicine thankfully gets reimbursed really, really well from insurance companies. And so your business is going to be making good money if you cover great preventative services. but at what cost? You have to understand the amount and the duration and kind of what the expectation is. And it, like I have a current clinical nurse practitioner student with me right now. If you start out seeing 40 patients a day, you will never be able to see any less than 40 patients a day without them asking why.
Yeah.
So
Good point.
I took the mindset of, I'm going to go low and slow. I'm going to learn what I'm doing. I'm going to get this right. I'm going to get the billing right. I'm going to get the coding right. And then when I get comfortable with who I am, then I'll focus on making some more money. But I think the hardest challenge as a practitioner is going to be having that mindset and watching someone else focus only on numbers, because you will find those people in primary care, because there can, you said, traditionally it's less pay, but there can be more benefit and more bonus in that depending upon where you're working. So you just have to change your mindset financially and understand that there may be some years that are challenging until you get your feet wet and that you're sturdy in your practice and you're figuring out how you want to bill and code. Or for instance, if you wanted to work indigent care, you just have to know that base salary is what it is. But the other side of that is there's some unique benefit in, like, for example, there's no secret in where I'm at right now. I work for the University System of Georgia. And so I have teacher retirement benefit. So while I may be like making less than any and all of my colleagues in this industry, I am looking and putting money into a future goal for our family. And that I know that is an extremely important trade-off that I don't have that benefit anywhere else. So you have to personally have some goals, priorities, make very tough decisions, but you have to include your family. My husband and I talk very frequently about all the career moves that I've made, but basically the pros and cons, the risk and benefits, how this is going to enhance our family. I would say at the lowest part of the list, we typically get to include money. And that's not because he makes a ton. It's just because we've realized that time and retirement and healthcare benefits are more important to where we are and where we feel like we're going than that income. So you just have to figure out where you want to be with that. But I would very, very heavily place caution on anybody who primarily is looking at salary to change into this industry, because I often see acute care providers in specialty groups be able to make about what they were coming out. For instance, I've had some colleagues that I know with like neurology or nephrology that were able to kind of stay comparable to where they were coming out of the hospital. But a majority of us kind of took steps back until we could get kind of ramped up into practice to build more and things like that. So just be extremely cautious if that financial element is a deciding factor in going back to school, because it may be a while before you get to that.
I know. So many people realize halfway through school, wait a minute, I'm only going to make how much?
No, it's not.
And I think to your point that in a lot of respects, like any career moves you make cannot be solely based on money. I think people who let money be the single or most important factor of all of them, outweighing all the rest, are going to find themselves probably vastly unhappy no matter what they do. So it is a piece of it. Clearly, it has to be a piece of it. We all need to make a living, but what reward do you get from the work that you're doing? And are you getting the reward you need based on what you're doing at the time? And money is just a piece of it. And it's, in my mind, a small piece of it.
Well, and to follow up with that, to say, so what you start making is not what you have to make for forever, in meaning that you don't have to change jobs, but you have to also think of a negotiation mindset that you become an entity that's important to them. As I mentioned earlier, like you're an investment to them. So the first time I sat down for negotiations at one of my practices, and they were showing me the market value. So this is where average nurse practitioners are being paid, and this is kind of what we see. And if you are keeping a lot of data on how productive you are for the practice, not meaning in like days time, but like if you can look through and help keep good data, you have a lot of leverage to increase your pay if you start doing well and you start seeing more and you start with production. Know that what your worth is to them, so that when they come to you and they say, well, this is what our numbers look like, you have your own to be able to justify and say, no, I actually saw about a about 3 to 5 more a week than what you have me down as. And I did call this day and I did this day. Are those being incorporated? You have to count those extra hours. So being able to be accountable and say, no, I know my worth and I know my benefit. And then negotiating well, you can't be afraid of doing that within your, practice. I think there's a lot of power in being able as a practitioner to negotiate for yourself and say, I know my worth.
Yeah.
So what you start making is not what you will always end up making. And you don't have to fight over it. You just have to say, this is the facts.
Yeah.
And people will typically respect that.
Yeah.
From where I started as a nurse practitioner to where I am now, I have had more challenges and turns and hills that I've had to walk up than I've ever thought I would. A piece of advice I could give individuals is to try to stay strong and to build a village around you to be supportive. Working at the bedside, people kind of anticipate to be there to support you. My husband would always, if I called and said, hey, I've coded someone 14 times a day, like I feel terrible, there would be a meal on the table, there would be support. It's really hard to call someone and say, hey, I've done 4 prostate exams today. And like feel the same amount of compassion for you.
Yeah.
And I don't mean that to be cheesy, but
Yeah.
it can get overwhelming as well. And just because
Absolutely.
you don't think about seeing death and seeing loss, like in an outpatient perspective, you will. I've had numerous patients that we facilitated palliative care and hospice for. And so it's physically and emotionally hard. And I think people look at private practice and family practice in the outpatient setting and they think, oh, it's this cushy job. It's
Yeah.
gonna be
There's no
all the
stress.
time.
Yeah.
Don't let yourself believe that, and try to help your village know that you are constantly going to need support, especially, they supported you through school. That support does not end just because you get a well-paying job or just because you get a job that you want. There's going to be consistent challenges. So make sure that you're giving yourself, I keep harping on that grace and understanding, because the challenges and the things that I have went through, I did not anticipate at all starting this. And getting out of the inpatient world, it was night and day different. And I don't know if I was as fully prepared for some of that mentally as where I am now. So just continue to give yourself grace and peace and self-care, and prioritize your life outside of the clinic, as well as your love and passion for healthcare in the clinic, because there is an extremely important balance between those two worlds.
Oh, such great advice, Audra. Oh my gosh, you just dropped some bombs on us today. I love it.
Hey friends, I'm so glad that you're here. If you are here, you are probably in the same boat I was in 7 years ago, where you're like, I think I should go back to NP school, but the universe isn't giving me any answers and this is a tough choice. That's the boat I was in. I started this platform here to answer all of those questions, to help mentor people in making the decision about going back to school, what to do, how to navigate the waters of school, how to acquire their dream job once they get out of school, because I also, in this process, taught myself how to interview. My husband started that, but I realized that nursing school doesn't teach us how to interview, and it is a very teachable skill, so why in the heck don't they teach us? But once you learn how to interview, you can wow them, impress them in a very competitive market. They will offer you the job over everybody else and will offer you more than they were willing to offer them because you did such an amazing job. I can't tell you how many times people tell me this. So if you're looking for interview strategies, you're in the right spot. I talk a lot about that. I also am a critical care NP, and that is my first love, is taking care of crashing patients. I love the buzz of it. I have always done that my entire career, from ER to ICU. And it is so much fun. If you need help with that trajectory of onboarding as a new grad ICU NP, as many of us do, I love to help flatten out that trajectory as well. I teach critical care topics. I do a lot of that on TikTok, so go check out my, I call them bite-sized teaching over there. And the meat and potatoes are kind of here. I also have a blog on my website, and I have the Acute Care Lab membership, where I do twice monthly lectures in a private setting on Zoom, as well as provide PDF templates to help guide your management of your patients. So if you're looking for any of those kind of resources, you have come to the right place, friends. And I am so, so glad that you're here. Thank you for supporting the channel and for watching my videos. Welcome.